Good morning, everyone. I'm Megan Culliff, along here with Scott Michlin.
Good morning. It is Thursday, May 27th, 2021.
Yeah. This weekend is Memorial Day weekend.
Yes, it is. That's true.
That is nuts.
Isn't it?
It's bananas.
Bananas. And this is week 63.
That's right.
Wow.
And we know because our calendar specialist told us ahead of time.
I know. She must now live for this moment every week.
Yeah,
and so she let us know last night it was going to be week 63.
Our loyal listeners.
So we appreciate that, but keeps us on the straight and narrow, which is what we need some weeks more than others. So there you are.
I always need it.
That's right. That's right. Look at this show. Look at that lineup.
That is a heavy hitting. This is going to be just a show of science mostly.
It is a show of science. Actually, most of them are shows of science, I would
true.
Say. But
reliable science, we should say.
But we have had, owls on the show, so,
Oh my gosh.
Right?
Spooky.
I wonder how Spooky's doing. Right?
Yeah.
I don't know.
We're going to have to do, God willing, at some point, coronavirus will fade into the annals of history.
Right.
And we can just do a litany of our favorite moments.
That would be great.
That would be amazing. So
perfect. I'm just texting our guest to tell her to call in.
That's good.
So we can do that, but we're going to talk in just a minute with our guest on the program. Rita Abboud is calling in from the Mexico Department of Health, Northwest Region. Also, as I said on the air, our favorite doctors in the world calling in.
True.
Right? Dr. Aaron Philpott and Dr. Brad Greenberg from San Juan Regional Medical Center to talk a bit about we wanted to ask them about the changing mask mandates. Why all of a sudden now are we allowed, if you're fully vaccinated, to not have to wear your mask necessarily when you're outside and things along that line. So they're going to explain a little bit of that to us.
Yes.
So I'm looking forward to that. So there you go. So that's what's happening.
Great.
So.
And you want to just go to the numbers while we wait?
We can go to the numbers because I think that would be a good thing. I'm going to skip through to the numbers because we're going to talk with Rita about vaccinations. And so we can go and click ahead to the numbers, which are going to be right here. So they're looking better for San Juan County, I would say. The map update will be next Wednesday, everybody. And so, I don't know. We're turquoise now. Because we were turquoise 4 weeks ago. I think since in the ensuing 4 weeks, if they were doing every 2 weeks, we probably would have slipped back 2 weeks ago.
Right.
We'll see where we go. But as of yesterday, we had 167 new cases in New Mexico for a total of 202,570. Of those, San Juan County had 19 new cases. Now, that's lower than they have been, maybe a little bit higher than the day before, but we were over like 20 for several days in a row a couple weeks ago. 3 additional deaths in New Mexico. None of those were in San Juan County, and we had 96 new recoveries reported yesterday for a total of 188,333 recoveries. So that's important to note as well. But as far as our numbers, and that's just one part of how they determine the color, right? But our cases are at 19 for yesterday. I think there were 13 the day before, so we're still plus 10.
Right.
And that is probably not where you want to be to try to keep in turquoise.
Right.
But there are other factors at work, and we'll talk about those too coming up. But the next map update is Wednesday, and so we'll certainly bring you that latest detail next week, of course, on this program. And, of course, we always share it right away on our social media pages and our website. So there are the daily numbers from New Mexico. Take a look at the Navajo Nation, and we can see that they had 6 additional cases yesterday. Their cases have been down as well, which is good to see. 4 additional deaths, though, reported yesterday across the Navajo Nation. Total now of 30,793 cases, 1,306 deaths across the Navajo Nation. And so that is kind of where things stand for them. But
right.
Cases certainly are lower on the Navajo Nation, so that's important as well. We can talk a bit about the watch list, and so that is the latest. As we heard this week, I believe the state ordered Piedra Vista High School to close for 2 weeks because of their rapid responses. They're on that list with 3. I'll talk more about that in just a moment, but we have Animas Elementary in Farmington with 2, Heights Middle School with 2, Hermosa Middle School with 2, McKinley Elementary with 2, Piedra Vista with 3, as we said, Kirtland Elementary with 2. So those are the latest rapid responses. And I think I skipped a page. Nope, I didn't. I think there's some others on there that didn't make it to the show. So apologies for that. I think there's some other Aztec schools that are on the rapid response and this week as well, but they didn't make it into the show. I don't know why. But about the PV comment, Piedra Vista High School was ordered to close yesterday, I believe, and today is their last day of class. So I believe the school district said they were going to keep the school open, but allow any parent who didn't want to send their child to school to not have to do that. But instead of closing down the whole school for one day, they were going to keep it open for the one day today to wrap up the school year, and they'll be closed for 2 weeks anyway.
Right.
So
Right.
that's what happened there. So there you go.
There you go.
Right? That's what's going on. We have Johns Hopkins numbers too.
We do.
Which I know you watch every day.
Mostly.
Yes.
Mostly.
Right. Well, they're going in a good direction, so that's
They are
good for a change, right?
going in a good direction, yes. So United States confirmed cases are now at 33,191,164, and United States confirmed deaths are now at 591,957. And as you mentioned, the daily cases and the daily deaths are trending downward, and the vaccines are trending upward. So
Right.
that is what we want to see.
Right. If you're looking at the video stream, of course, that's where we're looking at those 3 other graphs along the right-hand side. The red graph is daily cases, the white graph daily deaths, and the green, the vaccine doses going up, of course. And of course, every death is tragic, and we mourn those deaths.
Yes.
But the fact that they are coming down from their peak is encouraging.
Right. I mean, to your point, at some point, and this is like scientifically proven, numbers grow to the extent that our brains can no longer compute. So, stories about 12 people dying at once impact us actually emotionally greater than, over 500,000, just because of the way that our brains crunch numbers. But
Right.
to your point, you are right that is a tragic amount of individuals
Indeed.
in such a short time.
Right. But of course, as the cases come down, theoretically, and you can see those in the graphs, the numbers of deaths come down as well.
Right.
And so that's encouraging, since the numbers of cases are trending downward as well. So that's important.
Yes.
So there you go. Well, as we wait for our first guest to call in, why don't we go to our second guest? Do you think we can do that?
Yes, let's do it.
We can do that. Talk to our doctors, right?
Let's do it.
They are standing by because, they are committed to this program.
They were very committed yesterday.
So
as I
they are standing by. We did
rushed
text
in
them
late.
yesterday
Yeah.
afternoon, and here we go. Let's hear from them today on KSJE. Joining us this morning to talk a little bit about the new mask mandates that have been released by the CDC, our favorite doctors in the whole wide world.
It's true.
Right?
It's
Friends
true.
of the show, all those other things we call them, true. Dr. Aaron Philpott, Dr. Brad Greenberg from San Juan Regional Medical Center, good morning. Good to both of you. Thank you for joining us.
Good morning. Thanks for having us again.
Thank you for being here, both of you. And so I guess first question to you, Dr. Greenberg, let's start with you if you don't mind, and that is talking about these new mask mandates that we heard from the CDC, that fully vaccinated folks do not necessarily have to wear their masks when they are outside, and maybe even in some larger indoor facilities. Can you talk a little bit about the changing, I guess, evidence that made the CDC change their guidelines?
Absolutely. And so I think that we should really be very, very happy that we have vaccines that work. There's been growing evidence that shows us that getting the vaccine really substantially reduces the risk of contracting COVID, of contracting severe COVID, and also likely reduces the viral load in those people that do happen to even be infected with COVID despite vaccination. And so what we've actually found is that, and what the CDC is embracing, is that the vaccines work, and they believe that those folks that have been vaccinated in non-healthcare settings can indeed relax some of those masking requirements. And so I think that's it's really reassuring. I think that it's super important that folks do pay attention to some of these details, though, and that this applies to vaccinated persons who are actually with other folks that are also vaccinated. Folks that still have that are not yet vaccinated, and we again strongly encourage people to go get whatever vaccine is available to them. Those folks still do have to pay attention to many of the stringent public health measures that were put into place to safeguard the public health. Those include masking and hand washing and social distancing, et cetera. So, but for now, I believe that those folks that have had vaccinations are indeed able to relax some of those elements. And they are really what they're saying is that indoor and outdoor activities really are minimally, they pose a minimal risk to people who are vaccinated. And those vaccinated folks have reduced risks of transmitting it. But, you know, if they do have symptoms, we still strongly encourage, and so does the CDC, strongly encourage those folks to go get tested. So now, to be more detailed here, what the CDC has recommended is that folks who have been vaccinated can resume activities without wearing masks, except where it's required by a local or state or federal government, and that includes local businesses and workplaces. So folks still have to respect the rules of the establishments where they're going, the municipalities and states where they're going to also. And so folks who are fully vaccinated, resume domestic travel without testing requirements. And you can also refrain from testing after an exposure. And there are some exceptions for specific congregate settings, et cetera. And there's really no need to do routine screening testing if it's at all possible. So, so I think that there are some great relaxations here. This is all, again, a product of a vaccine that works. And we all have to do our part and get vaccinated so we can all enjoy these relaxation of restrictions, and we can continue with them moving forward.
Right, and I was going to follow up with you on that, Dr. Greenberg, about it really is all about the vaccine, because really the virus hasn't changed. It's still as infectious as ever, and the variants are, as we've talked on this program before. It really is to what the vaccine allows us to be able to do, correct?
Absolutely. I think, again, we are really fortunate to have vaccines that work. And so really this is a strong, strong message to anyone who is on the fence about getting vaccinated. Looks like there's really tangible things that could make your life easier after you get a vaccine. So get that vaccine and help all of us get back to something that looks and feels a little bit more like normal.
Great. And let's do a follow-up to Dr. Philpott. I have a question about still being able to transmit the virus. So what is going on there? Is there a viral load difference? Can vaccinated people still transmit the virus? It's just at a much lower probability? Or what is happening in the science there?
Yeah, that's a great question, Megan, and that's absolutely the first thing that came to my mind when this release from the CDC came out. We're obviously in a unique situation here, setting here in the hospital, and are swabbing everyone who comes in. So we have seen, not a small percent of people who have been vaccinated require hospitalization related to COVID. But generally, those with active symptomatic infection in the hospital are not vaccinated. Because we're swabbing everyone who's admitted to the hospital for our rigorous infection control precautions, we're picking up some post-vaccinated people that are positive. And this is in line with the studies. There have been 3 major studies that the CDC references in their sort of scientific brief, providing a background on the new masking policy, or the ability of vaccinated individuals to take their mask off, as Dr. Greenberg discussed. And these have shown that the vaccines, the Pfizer, the Moderna, mainly to date, have decreased, significantly reduced asymptomatic transmission, though have not eliminated it. So we still have a little bit of a data void zone where we are not certain about the transmissibility of these asymptomatic positive people post-vaccination. You're absolutely right, or alluded to that they found the viral load among those vaccinated who do test positive. It's called a CT value or a cycle threshold in the virology world, is actually lower. The viral load is lower among those vaccinated. So possibly less likely to transmit, but still a little bit of a gray area there. So as you can imagine, if you are a vaccinated individual like myself who goes home to an unvaccinated household of children, I still remain somewhat concerned about the possibility of picking it up if I take my mask off everywhere I go and bringing it home. So I've made the personal decision to still wear a mask just for that reason. So until we have a little bit more data on that front. And then the effectiveness, so the efficacy is defined as how effective the vaccine is in studies, and that the effectiveness is kind of the real world information of how the vaccine is effective, how effective it is against symptomatic or asymptomatic, which I just outlined. The effectiveness against symptomatic disease is quite high. There's about 7 studies to date, also outlined sort of in this scientific background of the CDC guidance, that shows mainly in the high 80s to 90% in preventing symptomatic disease. High, and I believe both of the Pfizer and Moderna showed 100% efficacy in preventing severe disease. There was recently M&M, and morbidity and mortality, that was actually, I think just yesterday on 5/25, showing that 123 million people have been vaccinated in the United States, and there have been 10,262 vaccine breakthrough infections. Of those, 27% were asymptomatic, and then 10% were hospitalized. Of those 10%, and these are the cases I mentioned, people coming in for other things like urinary tract infection or pancreatitis, testing positive. So of the 10%, 29% had no symptoms, and then 2% have died. So I think that's gives us a pretty good sense. These vaccines really, really work. But, the risk isn't eliminated entirely of that, of asymptomatic or symptomatic infection.
Right, but that's true of almost anything, Dr. Philpott, right? I mean, there's an inherent risk to just crossing the street, for heaven's sakes. So
yeah.
That's what I had to say.
Especially the streets that don't have stoplights anymore.
The streets that are flashing, be careful. Yes.
So
Megan?
We haven't talked about the surface, the question on how long viruses stay on surfaces in a long time. People are still practicing wiping stuff down, et cetera, which, I mean, don't get me wrong, I'm actually pro that. They should have been wiping down surfaces after people touched keypads for a long time before this happened. But where's the science at now with that? How long does COVID stay on surfaces? Does it stay on surfaces anyway? Dr. Greenberg, let's go to you for that.
So the frequent cleaning associated with COVID has yielded one of my favorite terms from the entire pandemic, and that's what the CDC has described as hygiene theater. They basically have talked about how, as we work through the unknowns that we had with COVID, it was really unclear how long it lasted on surfaces or what fomite-based transmission. That's basically from any kind of surface or object that someone could self-transfer by touching it and then touching a mucous membrane. We didn't really know what the likelihood was with COVID. And over time, it's really been demonstrated to be a very minor source of transmission. So I think it's important, though, that as we understand that it may be a very minor source of transmission, maintaining clean surfaces still remains something important that we should do, but it doesn't have to be done with the same fastidiousness or rigor that was emphasized earlier in the pandemic. We have at the hospital continued with cleaning protocols, but we've sort of relaxed them to basically make sure that we're keeping areas clean and paying special attention to rooms where we had folks that may have potentially had COVID. But those areas that are trafficked a whole lot less really get less, I would say, repeated cleaning. They still get routine cleaning, but repeated cleaning. So I think that it's okay for folks to feel, provided that they're washing their hands, careful not to touch mucous membranes, and wearing, if they choose to wear masks post-vaccinated in public settings, they can relax a little bit in, I would say, public environments, and can go back to more routine cleaning with standard kinds of soaps and disinfectants.
Understood. Thank you, Dr. Greenberg. And Dr. Philpott, I wanted to ask you about maybe looking forward as we live with COVID, because, I don't think we're talking about herd immunity as much anymore, but as more folks get vaccinated, as you both have suggested that they do, and the reasons why they should do it, because these vaccines are working. We have demonstrable facts that show that. Living with COVID, how do you think things are going to go? We're still going to be cleaning and surfaces and masking up where appropriate and things along that line. Where do you see ourselves this fall? Dr. Philpott?
Yeah, great question, Scott. I think it's difficult to predict, but I do have to say I think we all sighed a breath of relief hearing about the advancement of the CDC's, public health policy with decreasing the rigor of mask using and putting it to the individuals more. But I think overall I feel that if we can continue vaccinating and get the folks who have been waiting to not be the early adopters, but now 123 million people in, they aren't the early adopters. So as that continues to pick up, hopefully, things will start normalizing. And I'm really hopeful that we will get back to some semblance of a normal life. I think we all feel much more comfortable being with our older parents without a mask who've all been vaccinated, just those really basic human interactions and family dinners and those things we couldn't do last spring when this was all unfolding. So hoping for a normal fall, but there's always been surprises in store for us with COVID. So I think it's difficult to say. I think as we had discussed prior, our county has been vaccinated in a very heterogeneous way, meaning parts of the county are highly vaccinated and parts are not, and that's put us in a little bit of a unique position this spring as far as our numbers. So I think, again, there's so many factors, so many variables that makes predictions really challenging in these situations.
Of course. Dr. Greenberg, do you have anything to add?
I think that Dr. Philpott alluded to what's something I hope that everyone throughout the county does understand, is that even though we are doing really well when it comes to vaccination across the county, the manner in which the vaccine sort of is across the population is skewed westward. And so I really hope that folks that are on the fence here really hear this and understand how important it is to go get vaccinated. And if it's okay, I'd like to just go through a couple different numbers to highlight how different it is from west to east. And I think that because across our county, we like to think that we're very well vaccinated. But in the city of Farmington, and this is all broken down by zip code by analysis from the Department of Health, we have vaccination rates of I would say full vaccination rates of only 50% and 42%. Then extending to Bloomfield, it's only 37%, and Aztec is only just under 32%. So I think westward we have vaccination rates that are like 100% in Kirtland and Shiprock and Waterflow. But I think that it's really important that we acknowledge that, even as our numbers look so good, in the last several weeks at the hospital, we've actually had another surge. We had a whole new surge of COVID inpatients largely, as Dr. Philpott alluded to, of unvaccinated people. And so it's getting vaccinated is just such an important piece of trying to get out of this pandemic. And I think that it's very clear that a large swath of the population in those municipalities that I just mentioned still need to get vaccinated. And there's so many opportunities in our community to get that vaccine. I can't emphasize enough how important it is to do so. And that we, even as we're doing sort of like better from a numbers perspective across the whole county, we at the hospital are seeing the impacts of unvaccinated people who get sick with COVID. And we'd like to get out of this pandemic, and we're relying on every individual to make that choice to get vaccinated.
Yeah, very good reminder. Doctors, thank you, as usual, for joining us, sticking it out with us for this long.
Right.
That's a feat. So Dr. Aaron Philpott and Brad Greenberg, thanks so much for joining us today.
Thanks so much.
Thanks for having us.
And there you go. Doctors from San Juan Regional Medical Center. We always appreciate their time. Interesting, I think.
Always interesting.
To, you know, that we are where we are because of the vaccines.
We have this truly miracle vaccine
That's working.
And
we can see that in the
so
numbers.
well, yeah.
Right. And so that's what we want to share with everyone before we go today is the vaccines and the numbers and the new vaccine opportunities to get a vaccine if you have not already done so. And so across the state, and I believe these numbers are a bit delayed, so maybe they're from earlier this week. They're not way out of date, but I think there's even newer numbers that the state was a little delayed at updating. But here we are in New Mexico, right? The percentage of New Mexicans 16 plus with at least one dose is now 64.4%. The percentage of New Mexicans with the vaccination series completed 16 plus years of age is 54.2. And as you remember, the governor said we get to 60% and the colors go away.
Yes.
And we're on track to do that by the end of June. It looks like we may get there sooner with the numbers like this, but we'll see, right?
Yes.
But that's where we're heading. And so, that's whatever all of us can do to get us there. If you are wanting to get a vaccine and have yet to get one, make arrangements to do that so that you can help push that number higher.
Yes.
Is the idea. Here in San Juan County, look at us, right? At least one shot, 71.9% this week. Percentage of residents with the series completed, we're at 57.7, so we're right a little bit above that statewide average, so that's great. We're above average. Good. Way to go. As we shared last week, I think you remember we broke it down by zip codes, and even as the doctor said earlier today, there are folks on the eastern side of the county that are trailing behind the western side of the county, and so it'd be nice to get those numbers up.
Yes.
A little bit more equitable. So we do have some work to do, and that brings us to kind of where the clinics are going to be over the next few days. And so the Department of Health has shared with us their schedule for the vaccine events that are coming up. And so you can, of course, pre-register at vaccinenm.org to reserve your vaccine dose at any of these clinics that are scheduled for the upcoming week. And here's a few, and I'll kind of take turns with you, Megan, to read off when they're going to be for the radio audience. But we'll start with tomorrow, May 28th, at the Farmington Civic Center from 11 a.m. to noon. There's no drive-up services at that clinic, but it will be at the Farmington Civic Center, so there's plenty of parking in and around the Civic Center in downtown Farmington. Right,
and that's 11 a.m. to 12 p.m., and then Tuesday, June 1st, at the Bloomfield Cultural Center. This is the Johnson & Johnson vaccine, the one and done, and that's for folks 18 years and older, and that is also at 11 a.m. to 12 p.m.
Right, and then they're going to also do a noon to 1 p.m. Bloomfield Cultural Center with the Pfizer vaccine, is what that second line there means, and that will be at the same place at the Cultural Center, of course. Another event on the 1st.
That's right, at McGee Park, 4 p.m. to 6 p.m. on Tuesday, June 1st.
More of the Pfizer vaccines going out at McGee Park. And then Thursday, June 3rd, next week, here at the San Juan College Health and Human Performance Center, 11 a.m. to 1 p.m., another vaccine clinic here.
Yeah.
And so, again, you can go online, reserve your dose at any of these locations, and then when you get there, you should be able to get in and get out. I don't think there's been a lot of waiting for folks who've been going to these clinics, right?
It's been very efficient.
I think that's, again, to the What am I trying to say?
You're trying to say to the credit of Department of Health, I believe.
Yeah.
Okay.
And the local emergency managers
Yes.
and all the folks that are helping to make it smooth to go through. That's what I'm trying to say.
Yes.
Not very well, but there you go. There is the Bloomfield Cultural Center. More information, again, the Johnson & Johnson one and done from 11 to noon, and the Pfizer from noon to 1, as you mentioned.
Very good.
And then, again, you can go to register. 327-4461 is the San Juan County Public Health Office if you need help to register or have questions. And, of course, as we've always said, and as the doctors have always said, I know there are folks out there that are hesitant about getting the vaccine. They're not sure. And the person to ask is your doctor. Mm-hmm. Maybe not your Facebook friends
Right.
or groups
Right.
or other media, but maybe your doctor who
Yes.
already knows about your health and knows maybe what risks you would have if you developed COVID, a serious case of COVID, as opposed to maybe something with the vaccine that would maybe, you could still maybe get infected, but it would certainly be a non-hospitalized situation. Mm-hmm. And so that's what I have to say about that.
Very good.
So, also, we want to remind you about the other COVID vaccine clinic, which is scheduled for Wednesday, June 9th in La Plata, the Upper La Plata Water Users Association from 4 p.m. to 6 p.m. And that is, I believe, the historic schoolhouse, La Plata Schoolhouse, up on Highway 170.
That is.
And that's where you can go in the La Plata area for a vaccine on June 9th. That's a week from Wednesday.
Yes.
Next week already. How about that? And there's the information there at the address, and again, how to register. And of course, the Department of Health is again trying to remind everyone about the vaccine events and about what's going on. And they're also saying that they're doing some of these organization event. They can set up a vaccine site at an event. If you're having some kind of an event with your group, you can reach out to them at getvaxnm.com and submit a request form to maybe get vaccines at an event that you're maybe planning later this summer.
Yes.
Who knows? So there you go. I think that's
a
all
wrap.
the information we were going to share today. But
Yes.
that's a lot.
That is a
It's
lot.
always a lot, right?
So, yeah. Mostly hopeful, I think.
I think all of it was helpful.
Yeah.
What part of it wasn't helpful?
No, hopeful.
Oh, hopeful. I think
Yes.
all of it was hopeful too.
It's very, yeah.
Do you think? Okay. Good.
Yeah.
That's the point.
Yeah,
Yes.
yeah.
Okay. All right. We're there. Great.
Way more optimistic than we've been,
Definitely.
I think, in the past.
If you look at the 63 weeks, some of our programs, we've always tried to be hopeful, that's for sure.
Yes.
But some of the news has not always been hopeful. And,
No.
and so I think we're seeing certainly some light at the end of the tunnel.
Yes.
And
In fact, there was a period of time in the beginning where we had to intentionally tee up a positive story at the end.
Yes.
Because it was so
we didn't want to leave with just the big, heavy, weighty news.
Right.
So, but we're looking forward to more improvements in the vaccination numbers, percentages of New Mexico for next week, everyone. As we said, the map is going to get updated. We're very hopeful that San Juan County will remain in turquoise and not go backwards for our businesses. We love seeing busy restaurants, busy stores, everything else that we're able to do. The graduations that we've had last week were wonderful, at least in even the limited capacity, but to be able to see families in the stands.
That's right.
And seniors walking across the stage to celebrate. That was great. We weren't able to do that at all last year. So we are moving in the right direction, and we can keep doing it if we all work together, I think is the news.
That's right.
So share this program if you find the information helpful and hopeful, and we'll be back next week. Thanks, everybody. Thanks for watching. Bye-bye.